My name's Katie. I'm a Band 5 rotational physiotherapist currently working in the cystic fibrosis team. Working at UHS is very rewarding but challenging. UHS is a huge acute trauma centre. We take patients from all over Hampshire, parts of Dorset and the Isle of Wight. It being a major trauma centre means that you get to see lots of different types of injuries, lots of different conditions, patients with all different backgrounds, making it a really, really interesting place to work. Coming into work, you always see something different every day. You're always finding it really interesting and challenging in that way. Within therapies, the team working aspect is the most important thing. Everyone works together really well and supports each other. We have weekly supervisions and meetups with therapies department on a Monday, meaning that everyone can be learning from each other, doing in-service training together, always bringing different topics to the table. So different teams will bring information about their team to that meeting, meaning that you learn about all different parts of the hospital. We also have weekly Band 5 teachings, meaning that every week for an hour we have Band 5 protected time for in-service training, and we go over different, mostly respiratory topics, but a bit of a mixture, and that just means that you're always learning, always developing your physio skills, always talking to the other Band 5s, and it just creates a really nice supportive atmosphere at the hospital. At UHS we have a fantastic new wellbeing centre, recently being built last year and is free for any of the staff to use. You have to do a little bit of training online and then you're able to use the gym for free. Having a free work gym is unheard of at a hospital, and it just means that you don't have to worry about paying for a gym outside of work, and you can do your exercise on site, and it makes it so much easier. The Wellbeing Centre also has a cafe and lots of nice spaces that you can meet up with different staff members or colleagues to grab a coffee. It's a really nice space. We also have a preceptorship programme, so the first year that you join UHS, you will be given a preceptor. They will be there to answer any questions that you might have about work. There'll be someone who you don't directly work with in your team, so if you have any problems within your team, you can talk to them really easily and meet up with them every couple of weeks when you start, or more often if you want to, and it helps just guide you through that first part of joining the workforce after you've been a student, helps with that transition from student to a Band 5, and it just creates a really nice supportive environment. So I currently work in the cystic fibrosis team. We are a very close-knit multidisciplinary team, so we sit in an office with the physios, the exercise practitioner, the dietitians, the nutrition team and the medical team, all working together to talk through each individual patient that we might be looking after on that day. We've got the patients who are inpatient, so they've come in if they've been unwell with their cystic fibrosis, if they've got a chest infection or any other sort of problem they might have, they'll be up on the ward on D10. And then we also have our outpatients, so people coming in for their reviews, for annual review, they come in once a year, or if they're feeling unwell, they'll come in just to have a checkup. And we'll do clinics with those patients, spending half an hour or so chatting through their problems with them, trying to help them. But day to day, we come in the morning and we have an MDT meeting, so all those different professions coming together, and we discuss every single patient that we have as an inpatient, go through what they might be struggling, how they're doing. I'll talk through what I've been doing from a respiratory physio perspective, so have they been doing airway clearance, how are they getting on with that? Do they need any extra support? How are their nebulizers, their medications, are they managing those okay? And then after that, we'll be going to see those patients twice a day, which is quite nice because in other areas you can't see patients that often. Spending about an hour with each patient, doing our airway clearance, doing some exercise with the patients because it's really, really helpful for airway clearance, talking through if they have any concerns, just being generally very supportive for each patient. And it's a really, really great place to work. And the team's amazing. They've got social workers as well who can provide more support if the patient's struggling with anything outside of kind of their health problems. And and it's a really supportive environment to work in. I'm really enjoying working at UHS. I'm currently a Band 5 rotational position, so I've done MSK outpatients, medicine of older people, and I'm now on the cystic fibrosis team. So I've done about a year and a half doing those rotations. You'd normally do about 2 years or a bit more, but I'm just finding it really beneficial to gain experience in a diverse array of areas in the hospital. Within the next 5 years, I'd probably want to definitely explore a few different other rotations. I haven't done a neuro rotation yet, so hopefully we'll be able to go on and go and see our amazing Wessex Neuro Rehab Centre and be able to work in that department. And then after that, I'll have to kind of choose probably a more specialist area, so either respiratory, neuro or MSK, and then kind of go down that path of doing Band 6 rotations in one of those areas. So Band 5 rotations is really, really general, and you'll go around the whole hospital seeing every different area, and then when you become a Band 6, you can do a more specialist rotation. So within one of those areas, you'll move around a smaller number of rotations, but it's more specific to developing your skills in that area. As a Band 5, I'm still rotating, so I'm not sure what area I want to go into yet, but it's really nice at UHS. There's no pressure to specialise early. Like, they're very happy for you to keep exploring the different areas and developing your skills before you have to then specialise and choose one area. I do like the sound of the MSK Band 6 rotation, so it includes trauma and orthopaedics, get to see a huge diverse array of injuries coming through the major trauma centre here. So it's super interesting on trauma orthopaedics. And then they've got MSK outpatients, and they've got hands therapy and hydrotherapy, all within a Band 6 rotation, which I think sounds really interesting. But then I am really enjoying respiratory at the moment as well, so I'm not totally sure, but hopefully progressing onto a Band 6. A piece of advice I'd give to someone coming to UHS to work here would just be to take any of the opportunities given to you when you start work here. You can see so many different parts of the hospital. There's so many different specialities here, so many interesting surgeries and interesting procedures that they do here, and just taking any opportunity that you can to dive in and explore those different areas.